Hello everyone, I am Dr. Vijay, consultant rheumatologist working in Manipal Hospital, Bangalore. I welcome you all to this patient education session on one of the deadly diseases in rheumatology called SLE. I am doing this on the occasion of World Lupus Week, which is on the 10th of May, with the sincere hope that a lot of patients will be benefited by this, and it will help their anxieties to be reduced and be more confident with the treatment. So to start with, what is lupus? So lupus in Latin means wolf. In the picture here you can see wolf like bites on different parts of the body, that is in the mouth, that is on the skin, on the chest, on the hands and on the feet. Lupus attacks like a wolf and bites different organs. Okay, so our immune system is designed in a way that it has good and bad immune system. The good immune system helps us to protect infection, and the bad immune system is the one which causes SLE or arthritis. What exactly is this disorder? This is an autoimmune disease. Autoimmunity means our immune system falsely recognizing our body tissues as foreign and throwing certain proteins called antibodies to attack the tissues, which leads to finally tissue damage and consequences of that. The starting point of this disease is something called inflammation. So inflammation has certain components of which are redness or rubor, heat or calor, dolor or pain, and then swelling and loss of function. So these are the cardinal elements. So first step is the inflammation, which subsequently leads to damage and the consequences of damage. So what are the organs affected by the lupus? So if you focus on this slide, as you can see, lupus is a deadly disease affecting almost virtually every single organ. So I always start from head to toe. So from the head it can affect brain, causing confusion, memory loss, and in severe cases what we call as even psychosis or mania. You can see hairs, it can cause hair loss. You can see eyes, it can cause certain diseases such as inflammation in the eye. You can see the skin around the nose, it can cause malar rash, and you can see the limbs, it can cause joint pains, and it can affect the internal organs such as heart, lungs, liver, kidney. So essentially it can cause mouth ulcers, nose ulcers, butterfly rashes, and in the heart it can affect valves causing endocarditis or inflammation of the blood vessels called vasculitis. It can cause severe abdominal pain. It can cause different sort of blood changes such as anemias, reduced white cell count, which helps to protect infection, so that count is reduced. It reduces platelets, which causes bleeding, and it causes muscle and joint pains, and in serious cases can affect brain, causing stroke, and kidney, causing kidney damage, leading to a lot of protein and blood leakage in the urine. Okay. Although this is a deadly disease, it's not remaining deadly all the time. So it comes in episodes. In the initial phases it's high, but once after treatment it remains low. But the treatment is stopped, then it comes back high as well. And although it affects all organs which I mentioned, but it doesn't affect all organs together. So it's one organ at a time, or it might have 3 or 4 organs at a time depending on the severity of the disease. And the control with the medications might take some time. With the medications it might take at least 3 months to work, and in between you are expected to have flare-ups which are triggered by infections, sunlight exposure, or pregnancy. What is the cause of lupus? I often say this: lupus is like a fire. It needs 3 components of it. So that is A fire needs wood, a fire needs kerosene and matchstick. So wood are like, I compare genes to wood. So you need to have a genetic predisposition to develop SLE or lupus, and for just the wood will not create fire, you need kerosene for that. So hormones is known to cause lupus. So it's more commonly seen in females between the age of 15 to 45 years, that is in the reproductive age group, and any hormone fluctuations such as pregnancy or post pregnancy can lead to an SLE or a lupus flare. Thirdly, to ignite the fire along with wood and kerosene or petrol, you need matchstick, which is the sunlight. So sun exposure can lead to this disease as well. So these are the potential triggering factors. On the top of it, if you have SLE, you also get a flare up of SLE if you have any infection, which could be a viral or a bacterial infection. So it is not spread through contact. It's mostly a genetic disease which is acquired through genes. Who gets lupus? I've told you certain age group, 15 to 45 years, and women. So it can affect any ethnicity. It's more common in Asians actually, so we are more prone for it compared to the white population. And what are the different types of lupus? So the most serious form I told you is affecting the head to toe different organs. It can also affect just the skin only, we call it as cutaneous lupus. It can be affected by certain drugs called drug induced lupus, and when women with lupus or SLE have kids, it can transiently it can lead to SLE in the newborn called neonatal lupus. Okay. The most serious form of it is the systemic lupus erythematosus or SLE affecting different organs. I've already shown you that it can affect different parts of the body. So just to go over it again, it can affect the blood, causing anemia, low white cell count and platelet anomalies. It can affect the skin, causing skin rashes or reduced circulation to the skin called Raynaud's, or even it can affect blood vessels, causing skin ulcers. It can affect the brain, causing stroke or psychosis. It can affect the lungs, where it causes pleurisy or the inflammation of the covering of the lungs, or causing fluid accumulation in the lungs. It can also affect the heart, causing problems in the heart valves, or problems in the internal lining of the heart called endocarditis or myocarditis. It can also affect the kidney, causing urine or protein leak in the urine or blood leak in the urine, and also causing joint pains and muscle pains. So the severe form of it is when it's affected the brain and also it's affected the kidney. Other ones are potentially less serious ones. So in cutaneous lupus, there are various versions of it. As you can see the slide, it can affect butterfly rash, typically a butterfly fashion which is caused by sun exposure. It can cause hair loss, causing, if you see on the head, all the hair is lost here. It can affect ulcers in the mouth, and it can cause widespread skin rashes. Certain medications are known to induce this, but the good news is once you stop the medications, the disease will go away. So you must be worrying if you have any of the following symptoms. If you have hair loss unexplained by any other disease, if you have rashes on your cheeks and exposure to sun, if you have recurrent ulcers in the mouth, if you have joint pains along with swellings, if you feel extremely tired out of no reason, and if you start having protein leak in the urine, along with any of the serious manifestations such as psychosis or any blood problems which I mentioned before, then you need to consult your physician in order to be referred to a rheumatologist. So how is the diagnosis of lupus done? It's predominantly a clinical diagnosis we do. So we take a good medical history to ascertain the entire organ involvement, where a specialist like a rheumatologist needs to be questioning the patient who is aware of these symptoms, Most often patients may not remember this, so that is why you need to see a rheumatologist. And on examination, the rheumatologist confirms whatever he or she has elicited in the history to actually check whether those particular signs are there in the patient. Based on that, we can request blood tests to check blood counts, to check liver and kidney, to check inflammatory markers such as ESR and CRP, and then comes of course the autoantibodies such as anti-nuclear antigen ANA and also rheumatoid factor. In most situations, more than 95% of patients will have ANA test positive. So it is essentially a good screening test, and once this test is positive along with the symptoms, then the diagnosis of lupus is made. So there's no one particular test, it's a combination of the ANA test, the inflammatory markers, and the medical history. In certain situations, we would also need a biopsy, in which we take a piece of tissue and examine under microscope. So it could be a skin where the rash is, we check it for immunofluorescence, or it could be a piece of tissue from the kidney. If there is protein leak or blood leak in the urine, we check for kidney biopsy, but this is in the severe stages. Now, what happens if this lupus is not treated? As I told you, it can affect circulation, it can affect vital organs, so it can lead to stroke, and in severe cases can have multiple strokes causing obstruction of blood vessels and ultimately death. It can affect kidney. Without treatment, most of these patients die within a year, so it is essential that treatment is instituted in these patients. But the good news is, with treatment, more than 80% of patients live a long life, a completely normal life. And also it can lead to recurrent joint damages if it is not treated. So what are the treatment options? The treatment options are painkillers to reduce the pain, anti-inflammatory tablets or injections to reduce inflammation, and preventative treatment to reduce the flare-ups. So the idea is to minimize the organ damage. So we also check for sugar levels in these patients, cholesterol level in these patients, so that diabetes, cardiovascular complications, cholesterol and all those are very well managed. Medications, lifestyle modifications are the key things. Okay, and in the medications we have non-steroidal anti-inflammatory drugs or NSAIDs to reduce the pain, inflammation and swelling. We have the steroids, which is needed to treat some of the severe complications, which we gradually taper off within 3 to 6 months. We have anti-malarial drugs, which are very good these days to control SLE and prevent lupus flares. So they are very safe, and it prevents diabetes and cholesterol complications in lupus patients as well. And finally, it's the immunosuppressives, which keeps the immune system under control. These come in the form of tablets and drips or injections as well. Certain lifestyle modifications is very, very important. So I always ask my lupus patients to be physically active. So engage yourself in cardiovascular exercises, stretching exercises, muscle strengthening exercises, and certain activities like yoga, tai chi or swimming. All these help prevent muscle damage, they give muscle strength and improve the balance in these patients. So hence I recommend regular physical activity should be almost as regular as taking tablets. It's also important that you avoid direct sun exposure. So I urge all my lupus patients to use sunscreen lotions with a sun protection factor, what we call as SPF factor 50 and above, and use umbrellas whenever you directly expose to yourself to sun, because sun can produce antigens in genetically predisposed patients, and especially in hormonal fluctuations which are seen in women can lead to a lupus flare. And certainly last but not the least is a healthy balanced diet. So it's very important lupus patients avoid certain types of diet. So the things which you have to avoid are basically which I've summarized in this slide, that avoid red meat, avoid cheese, butter, avoid alcohol, avoid smoking, which is very bad for lupus patients, and then uh, you know take more of green leafy vegetables, as it is written here. Yes, so fruits and vegetables, green leafy vegetables, different kind of pulses, and fish as well. Okay, fish and chicken are fine in lupus. So you have to maintain healthy weight, quit smoking, regular health checkups, do not stop medications without the advice of your rheumatologist, which is very very important. And as soon as you notice a flare up that has which such as fatigue, skin rashes, mouth ulcers, fevers or joint pains, see your rheumatologist straight away. Another important aspect of SLE or lupus is pregnancy. Let me tell you briefly about pregnancy and SLE. It is a very well known phenomenon that pregnancy is a high hormone state and can lead to SLE or lupus flare up. But it is widely wrongly publicized that SLE patients cannot get pregnant, and in fact it is painful if some of the patients have come and told me that the gynecologist have asked them to abort the baby, which is very very wrong. Majority of SLE patients do well in pregnancy, they have normal healthy babies. So there is no absolute contraindication for this. However, remember the following points. If your SLE is active, that is you have more mouth ulcers, skin rashes, joint pains, weight loss, kidney problems due to SLE, brain problems due to SLE, then it is suggested not to get pregnant at least for 6 months. Control your disease and then you can get pregnant. It is vitally important that you must discuss with a rheumatologist only before getting pregnant, because a rheumatologist is widely aware of how to manage complications in pregnancies. So you must be on close consultation with a rheumatologist and gynecologist who has had expertise in management of these patients. These cases should be handled only in expert center, not in smaller nursing homes, because if there are unexpected complications, then you will end up losing time shifting to a smaller nursing home to a bigger tertiary care hospital. It is also important that certain blood checks are done monthly basis for SLE patients in pregnancies to observe changes in the urine and changes in the blood test. It is true that some of the medications cannot be used in pregnancy, such as mycophenolate, which is sold by the trade name of MMF, Morphylet, Renodapt, so on and so forth. So those should be stopped at least 6 weeks to 3 months before pregnancy, before you plan for pregnancy. Methotrexate, which is sold in the name of Folitrax, Oncotrex, Mext, Neotrex, should be stopped 3 months before you plan for pregnancy. That is, the day you stop, 3 months late, till 3 months after that you have to continue contraception, and then only you can get pregnant. Certain tablets are safe in pregnancy, such as sulfasalazine, azathioprine, cyclosporin, tacrolimus, hydroxychloroquine. So these can be continued throughout pregnancy and lactation. Sulfasalazine need folic acid supplementation, so this please discuss with your doctor about it. It is vitally important that you should not stop any medications of pregnancy without consulting your rheumatologist, otherwise it might affect the outcome of your baby and the mother's outcome also. It is also known that in some of the SLE patients there is an antibody called Rho antibody. So this has to be checked while your pregnancy test is positive. So there is a test called ANA profile which has to be done, which checks certain antibodies called Rho and La antibodies. So what these antibodies are is that if 100 babies, if 100 SLE mothers have Rho and La antibodies, one mother can transfer that Rho and La antibody through the placenta to the baby's heart, causing heart block. So it's 1% risk. It is extremely rare, but it is important that we recommend normally SLE patients to actually undergo this test at pregnancy test positivity, so that we can plan. These patients will need fetal heart rate, that is baby heart rate monitoring from 16 weeks of pregnancy till delivery. And if the heart block is detected, then it needs to be managed by a fetal medicine expert along with a neonatal cardiologist, so that they can manage the good outcomes of the baby. There is another concept of antiphospholipid antibody syndrome, also called APLA syndrome, which is seen in about 15% of patients with SLE. So APLA is nothing but sticky blood syndrome. So in SLE patients with this syndrome, the blood becomes sticky. As it is in SLE patients, blood is slightly sticky, but with APLA syndrome, the blood becomes gum-like and can cause obstruction of the flow, leading to things like strokes, or what we call as deep vein thrombosis, pulmonary embolism, or that is a blood clot in the lungs, and strokes as in brain, or heart attacks. So it is very scary to see a young patient having a heart attack, but always check for SLE in these patients. APLA or sticky blood syndrome is diagnosed by a simple blood test where we check 3 types of antibodies, and 2 times we check 3 months apart. And if you have history of blood clots, or if you have history of recurrent miscarriages with APLA antibodies, then you need to be on what we call as blood thinning agents called heparin throughout pregnancy. And out of pregnancy, if there is history of blood clots, then they need blood thinning agents such as anticoagulants or warfarin. And again, these are treatable conditions, nothing to worry, but it has an association with SLE. Last but not the least, remember, it's you who is important and not disease. So you must have a positive outlook to life. Having lupus or SLE is not the end of life. What is more important is you should be in a positive mind, be able to take the diagnosis, look after yourself, take the recommended treatment, and get on with your life. As it is said, an empty mind is a devil's workshop. Having the disease doesn't mean you cannot work. Take the treatment, follow regular healthy lifestyle, avoid smoking and consumption of alcohol, take healthy diet and regular tablets. You should lead a normal life. All the very best to you. I hope you have gained much from this video. Thank you very much.